Mr. Richards.
Hello.
Hi, my name is Leanna, and I'll be your registered nurse.
Hello, Leanna.
All right, let's see. So it looks like you're here for a peripheral arterial disease, and that you're in need of an arterial bypass to help restore circulation to your left leg. Do you have any questions for me about that?
I think I'd just like to know more about the surgery and the complications involved with that.
Okay, great. Well, what an arterial bypass surgery is when we take a vein from your leg and bypass the blockage of the artery due to arterial disease. So here's a diagram about what we're going to be doing. Here's the vein right here of your leg.
Okay.
We're going to be using a synthetic graft for your surgery, and it should take 3 to 4 hours under general anesthesia.
Okay.
There is some risk involved with the operation. Although it's rare, bleeding, blockage of the bypass graft, severe leg swelling, infection, and heart problems may occur. And if those do occur, they'll require more surgery. Does that answer all your questions for right now?
Yes.
All right, great.
Hi, Dr. Smith. I just wanted to let you know that the graft for Mr. Richards became blocked 2 days after surgery, and now he requires a below-the-knee amputation.
Hello, Mr. Richards.
Hello.
Hi, it's Leanna, your registered nurse. Looks like you're going home today. That's exciting.
Yeah.
So I've just got a few questions for you about your pain. On a scale of 1 to 10, how would you say your pain is today? With 1 being no pain and 10 being unbearable.
Well, I'd probably have to say the pain is probably around 2 at this point.
Oh, good.
The thing I'm most worried about is going home and getting around like I used to.
Yeah.
My wife passed away, and my favorite pastime was gardening, and I'm not even sure if I'll be able to do that now, unfortunately. I don't know how I'm going to be able to go to the store and get groceries and get my mail and just do everyday things. I'm just most worried about that.
Yeah. Well, I understand you're very frustrated right now and nervous about going home, but we can work this out together. I'm going to talk to your doctor, and together we're going to come up with a plan to make your transition back home as easy as possible for you.
That'd be great.
Oh, Dr. Smith, good morning.
Yeah.
I just want to talk to you about Mr. Richards' concerns about discharge.
I'm really busy. Can you deal with this on your own? Because I have a lot to do today. I can just look at this chart quickly and just sign off on it.
All
That
right.
works. Yeah.
Okay, thanks.
Negative reaction number 1. The nurse was passive when she did not obtain the necessary information from the doctor regarding Mr. Richards' discharge. Negative reaction number 2. The nurse accepted she was inferior to the doctor and did not demand the professional respect she deserved as a nurse. Negative reaction number 3. She did not intervene when the doctor did not provide viable time for questions and concerns about the patient. Negative reaction number 4. The nurse was nonspecific and vague. She did not use SBAR assessment when presenting the situation to the doctor. She also did not advocate for the patient.
Man, I really hope Tommy's okay.
I know. Oh, okay, I'll see you later. Oh, Dr. Smith? Yeah. I just wanted to talk to you about Mr. Richards' concerns about discharge.
Listen, I'm really busy. Can you deal with this on your own? Or can I just see his chart?
Yeah, here's his chart.
Okay.
And I understand that you're really busy, but he's scheduled to be discharged today, and I could really use your help finalizing a plan for his transition back home.
I'm actually taking a lunch break in an hour. Can we meet in my office?
Yeah,
and
that'd be
discuss
fine.
options?
Yeah,
Okay.
great. Thank you.
You're welcome.
Dr. Smith?
Yeah.
It's Nurse Jackie. I'd just like to talk to you about Mr. Richards.
Okay, yeah, one second. Yeah, can I talk to you later? Okay, thanks. Yeah, come in, have a seat.
How are you today?
I'm good, how are you?
Great.
Great.
Okay, so yes, I'd just like to talk to you about Mr. Richards' discharge plans.
Okay.
So to begin with,
Mhm.
Mr. Richards is a 67-year-old man
Mhm.
who came in because he has peripheral arterial disease, and so he had an arterial bypass to restore circulation to his left leg, which was limiting him from activities due to the pain in his left calf.
Mhm.
He had surgery, but then 2 days after that, the graft became blocked, which required a below-the-knee amputation.
Okay.
So the patient is very concerned about returning home after the surgery because he's an elderly widowed man who lives alone, and he wants to be able to continue to do activities around the house such as gardening.
Mhm.
So I suggest that we work together to help and set up Mr. Richards to either be fitted for a prosthesis for his residual limb,
Mhm.
or to refer him to an occupational therapist, or have a home care nurse come work with him.
Okay.
So what do you think would be the best option so I can research and discuss his options with him?
I think at this point we should go talk to the patient and see which option best suits him. I can contact an occupational therapist and set up an appointment for Mr. Richards. Do you think that sounds good?
Yeah, that sounds great.
All right.
All right. Hello, Mr. Richards.
Hello.
Hi, it's Leanna again.
Hello.
So I've discussed your discharge with your doctor, and we've set you up with an occupational therapist. And if you'd like, we can also set you up with a home care nurse to assist you for your first few weeks back home.
Okay. Thank you. That should help out and hopefully make things a little easier.
Okay, great. Do you have any other remaining concerns or questions for me?
I don't think so. I think you covered pretty much everything I had questions with, but if anything else pops into my head, I can contact you.
Yep. And I have this paper here. It's just an overview of what we've discussed. And there's also a list of numbers for the occupational therapist and the physician so that you can contact them if you do have any more questions.
Okay.
The nurse uses the SBAR assessment when speaking to the doctor. SBAR helps organize your thoughts and is the most concise way to inform the doctor of the necessary information to analyze the patient's situation. S. Situation. The nurse informs the doctor of the patient's name and the situation. Hello, Dr. Smith. I would like to just talk to you about Mr. Richards. He is concerned with his discharge plans. B. Background. Patient background information. He is a 67-year-old man who has peripheral arterial disease and had an arterial bypass to restore circulation to his left leg, which was limiting him from activities due to pain in his left calf. He had surgery, but 2 days after, the graft became blocked, which required a below-the-knee amputation. A. Assessment of the patient. The patient is very concerned about returning home after surgery because he is an elderly, widowed man who lives alone and wants to be able to continue to do activities around the house, such as gardening. R. Recommendation. I suggest we work together to help and set up Mr. Richards to either be fitted for a prosthesis for his residual limb, or refer him to an occupational therapist, or have a home care nurse work with him. What do you think the best options are so I can research and discuss these options with him? Communication skill number 2. The nurse was assertive in advocating for her patient. Communication skill number 3. The nurse gained professional respect from the doctor.
That's on a scale of 1 to 10. Did you do that on a scale of 1 to 10? How did you do?
And then should he answer first before you say are you ready to be discharged?
Yeah.